11:29 on the clock. A very, very good morning to you. And now we're getting into a serious conversations. After I feel that you have kind of settled into the show, it's time that I introduce you to my next guest. He is Dr. Arif Adenwala, consultant, ophthalmologist, cataract and LASIK surgeon. Good morning, doctor. Welcome to the show.
Good morning. Good morning, everyone.
A very good morning to you. Now, doctor, first things first, today we are talking about computer vision syndrome. What does this actually mean and how can we help ourselves? If you could just put this into perspective and tell me, what is the computer vision syndrome?
Good morning and to all my listeners. Thank you for letting me come on air and share this common condition. And this syndrome of computer vision has become quite common nowadays because of the post-pandemic era. As you all know, we cannot live without the screen. Now, everyone, right from morning till night, 24/7, is using some amount of screen. So this computer vision syndrome is an entity which is nothing but a digital eye strain, which involves the eye-related problems because of the usage of the screen. So either it can be any tablet or phones or mobile, anything related to that, which can cause some eye strain, headache, pain, discomfort. You're not able to do your routine activities. So this is a complete syndrome which gets affected because of the usage of screen.
Absolutely. Now, doctor, can digital screens actually harm your eyes?
The screen does not, but it's how much time do you use the screen, how you are sitting, what is the other additional factors, that the font which you have, whether you are using the right glasses, the glare, the background environment, everything plays an important role, and the duration you are using the screen. So just use digital screen only per se doesn't affect, but if you are not taking care of all other conditions, then yes, it causes a serious problem on the long-term basis.
Now, does increasing the size of the screen, will this help or cause less problem to the eye? And what distance should a person be sitting before watching, anything at home, especially when the matches are around the corner? We are consuming so much of content online and even around the corner. We are consuming so much of content online and even on our televisions as well. So what's the distance? How far should I be sitting?
This is a common thing which parents usually ask. Now the child is using tablet. Can I shift it to a big screen or monitor? No, any type of digital screen does affect. And bigger the monitor, like if you have got large screens, maybe 100 inches, everything, then you have to sit at the far distance, maybe 4 times the size of the screen if you are using a TV. At the same time, laptop, you have to use it in the sitting position or the tablet. The angle where you are using this digital small instruments is also important. So just by increasing the size doesn't mean that you will not cause the problem to the eye.
Right. Now, Dr. Arif, should one be wearing glasses, especially if you're sitting before a computer?
Anti-reflective glasses do help, but at the same time, it's not like just because you're using the glasses means you are done with it and you can use the screen for a long time. It's how you take the break while using the screen is important. So we always document a 20-20-20 rule. So we always tell the person that after every 20 minutes, you try to look away from the screen at a 20 feet distance for 20 seconds, then again look at the screen. So this regular breaks and following the rule will relax your muscle and not cause eye strain or discomfort because of the computer.
Right. But doctor, when it comes to children, it gets very difficult. The only way that they can sit still in one place, and I know it's a very wrong thing to do, especially when they're eating their food or, when you want them to focus on something, is when the screens are on, because they get so immersed into them that it gets very difficult, for them to kind of break away from those motions and come back to reality. So with a child, how careful must one be?
You have to educate the child is the most important thing. Try not to give them digital screen while eating food, because then it will be difficult for you to stop. And as I always tell my patients when they come, the kids, that use maximum 1 hour of the screen time and sit and try to engage yourself in some physical activity and not just playing games or watching YouTubes and everything on the screen. And in case if you are not able to see clearly, you get headache, strain, then you can just get the eye checkup done. Maybe they have got some amount of refraction or the glass numbers which needs correction.
Absolutely. And now, doctor, talk to me a little bit about the eye checkup. When must that be done?
What we normally advocate is once the child is more than 3 years or is sensible enough, you should always get at least one checkup done to see whether the child needs any glasses. That's the reason whenever the child goes to the school, they have a regular checkup where they try to, in the school, to check one eye at a time. And in case if the kids complain of headache, strain, if they are not able to see clearly, then they should get a checkup done. And once one checkup is done, then every 6 months to 1 year, depends on the condition, the doctor is going to explain to you.
Right.
And in case if the parents are wearing the glasses, then definitely the kid they need to get at least one checkup to see whether they need glasses.
Right. Is it hereditary, doctor?
Yeah, it is. But at the same time, we have got so many kids who parents wear glasses, the kids don't have it, and vice versa. The speed at which the power increases is more common when you're using more of digital screen.
Right. Now, what is blue filter glasses? If you could explain to us a little bit about
These are
this.
the glasses basically which prevents the blue light from entering the eye. Uh, it does help, but not 100% that is there, because you need to have everything, the blue filter glasses, or sometimes you need anti-reflective coating, and same time have the precautions. Just by putting the filter doesn't prevent the eye strain or tiredness or dryness or headache. It helps a little bit, but not to a major extent.
Correct. Now, doctor, is there a particular age for the first eye consultation, especially in children, and how often must they get themselves checked?
Once they start going to the school, I think they should have a checkup, and which sometimes it is not always for the kids are not so cooperative, but at least one checkup just to see the other condition, whether the alignment of the eyeball or there is any squint or any other things are there. So at least once when they enroll the school, they should get a checkup done, and the doctors will advise you accordingly when the next checkup is due.
Correct. Now, any particular drops to kind of instill in the eye?
Now, once the child or any adult starts using the glasses or using the screen for long term, the common condition is the dry eye, where the normal blinking of the eyes, like when you're talking with someone away from the screen, you normally blink around 15 to 20 times. But when you look at the screen, the blinking becomes less, which causes the dryness. So this dryness will affect the outside part of the eye and causes some strain. So if you keep putting the lubricant drops or artificial tears on regular basis, this will moisten the eye and make you feel comfortable, relaxed, and you can use the screen for a long time.
Perfect. And once again, doctor, could you, if you could just talk to us a little bit about specific postures while using a desktop or a laptop?
Yeah. So when we explain to the patient, the idea often goes, because we cannot tell them to stop using screen, because without screen it is impossible. They might listen to us, but I know it's difficult to follow. So it's a condition where how you sit on while using the desktop or laptop is most important. Your neck posture, your fingers, how you're putting, and in case if how your feet is there, everything is important, because you should not bend your neck too much, or you should not elevate your neck. The top of the screen and your head, eyes should be at the same level. And the main thing is you should be comfortable, your fingers, your wrist, everything, your back should be straight and not couched in the front. And you have to take a extra effort of maintaining your posture, because if you're using the screen for a long time, after 5 minutes you will change your posture. So you make a deliberate attempt to sit straight, look at the screen, keep blinking your eyes, follow the 20-20 rule, see how is your keyboard, whether you are putting the fingers properly, it is not causing you a wrist pain, because spondylosis, neck problem, headache, tiredness, it all gets affected when you're not sitting at the proper position.
Right, absolutely. And
And
doctor,
your
once
other
again, we got
important
a
thing is
question. Sorry, we got a
yeah.
question that is coming from Anil, and he says, could you explain the 20-20 rule once again?
Okay. So this is the most important rule which you always explain to all our patients, that after 20 minutes of using computers, try to look far, 20 feet away. You can look anywhere, whether it's outside the window or any other people, anywhere, because you will not measure 20 feet, but just move your face face away from the screen at the far distance, wait for 20 seconds, try to blink, and then again look. So after every 20 minutes, look far 20 feet for 20 seconds, and then again go back to your screen. So you don't have to actually physically get up and go around, because this is a thing which normally they say, we can't get up, we have to be on the computers all the time, 8 hours and all. So you make a conscious effort of blinking and moving away from the screen.
Absolutely. I think it's point taken and point noted, Dr. Arif. Thank you once again for being so kind, talking to us on the radio and educating all of us about the computer vision syndrome. You're more than welcome.
Thank you. Thank you. Take care. Bye.
You too. Bye. All right. I will catch you very soon. Coming up again are two tracks that I love. One is Tanha Tanha, and the next one immediately that you're going to hear when I keep quiet is Aankhon Mein Kya. If you know what song I'm talking about, that's coming up next. If you want to say anything to me, any messages that you have for me, well, if you want to tell me how amazing your weekend was or just want me to gossip with you, I am that too. Give me a call on 800-81003. Or even better, you can send me a message if you can't really pick up the phone and talk to me. 0586861003. Good morning.
Now that's something special, John.